Anyway, with that being said, let's go to our guests.
Yeah.
Shall we?
Cheery setup. Let's hear from the hospital.
Let's do that right now on the phones, calling in. We appreciate them being with us again. Dr. Bob Underwood is on the phone this morning, and also Eddie Carraro is on the phone as well. Good morning, gentlemen. Thank you for being with us.
Good morning.
Good morning.
Thank you for calling in, both of you. And I guess, Dr. Underwood, could we start with you about the current situation at Salmon Regional Medical Center?
Sure. So, kind of just following along with the state level, of course, things are very, very busy here at the hospital. We have 95 patients, actually 93 that are already positive for COVID. And then we have 3 that we're waiting for the test results to come back. So indeed quite busy. Our regular ICU is completely full. Our step-down ICU, which is kind of an intermediate care, is already being converted to an ICU, and it is also full. And then we have a number of ICU-level patients. In other words, it's the care that they need up on actually 2 of the floors right now. So quite busy. And we're also have more, of course, coming in every day. So it's a big turnover, as you would imagine. We have, with the crisis standards of care, that's kind of what gives us the opportunity, if you will, to convert quite a number of beds into ICU level of care so that we can care for the patients that do come in. So busy emergency department as well. Right now we have 5 patients that require admission that are still in the emergency department waiting for beds. So as you alluded to at the beginning, we're very busy and doing what we can for our community. You know, one of the big problems is everybody in the state, you were talking about state numbers just a moment ago, and everybody in the state is pretty much as busy as we are. And so normally when we would get this busy, we would transfer to other parts of the state that had open beds. The problem is nobody really has open beds, so there is nowhere to really send people.
So is it conceivable, Bob, that we're going to see some field hospitals set up? I mean, that was kind of something that was talked about in the beginning.
Yeah, no, we're not going to do that. We will continue to convert other parts of our hospital as we need to. We can expand, for example, into the post-anesthesia and post-surgical care areas if we need to, but we have not done that. Those are other options, and we would try as best we could to really just convert what our physical plant is, and we're not going to have tents set up outside or anything like that, from what we can tell right now.
Very good. Thank you, Dr. Underwood. And Eddie Carraro, welcome to the program. I wanted to ask you a little bit about the situation with staffing, and I imagine that just exacerbates what Dr. Underwood is talking about with high levels of patients and staff levels maybe not at a level that you would like to have them. You've got openings in multiple departments, don't you?
Yes, thank you. It's definitely, on one hand, been very helpful that we've had help from the state and the Federal Department of Health in providing us temporary staff relief. That being said, we still have a number of positions open and really just looking for those in the community that either have recently retired from healthcare as a profession, or maybe they're working in a different capacity and they have the availability to take on some extra shifts and help out their friends, families, and neighbors, some of which are here with us at the hospital. And so we do have openings for nurses, nursing assistants, radiology technicians, and physical therapists, speech-language pathologists, several positions. EMTs, we've had several from local fire departments that have offered to take extra shifts, and these are all paid shifts. Respiratory therapists, and a lot of times people don't think about it, but environmental service aides, housekeepers, janitors, we need their help as well. In addition to anyone who would like to volunteer, we can find a place for everyone in the community to participate, but we're all in this together and just reaching out to see if we can get some extra help from the community over the holidays.
Very good. And so that's an interesting point on volunteering is when we talk about community members who are able to volunteer. I mean, I know that there's like medical reserves, things like that. But if we're talking about unskilled people, where are those folks going to go?
Well, through our volunteer services department and our hospital auxiliary, they have several projects, some of which are non-patient facing, but everything from assembling baskets to care cards to just really supporting our caregivers. And so we welcome them and appreciate any help that volunteers can provide as well.
Understood. And Mr. Carraro, how quick is the onboarding process? I imagine it depends on position to position, but how quickly can you get some of these folks back on board, would you say?
Very quickly. We have a fast track for those that are taking on some of these temporary positions, and it's easy to apply. They can either come in or they can call the main number, and we'll take down their information and actively reach out to them on their interest and the hours that they're available. And if you'd like, I can provide that number and that information.
Very good. And Eddie, this might be a subject that you don't want to speak on, but what is the deal with these exemptions that we hear about? How has that been going for you guys?
So several, are you referencing a vaccine exemption?
Yes, given the mandate, yeah.
Okay. Well, the vast majority of our caregivers and those coming to us have made the decision to become vaccinated, and that is the safest and the most encouraged option. But for those that have deeply held religious belief, the state and the law does provide for them to apply for an exemption, and we will review the exemption and approve it if it meets the requirements. There's also a medical exemption and disability exemption. So there are some circumstances where some are not able to receive the vaccine, and we respect and honor that.
Got it. Thank you very much. You mentioned, Mr. Carraro, talking about the phone number that folks can call to maybe apply or get more information about the openings that you have at the hospital. Why don't you share that with our audiences if you don't mind?
Absolutely. They can reach out to the main phone number at 505-609-2000. And they can also stop by the Centers for Workforce Excellence. That's the HR offices, and that's located on 800 West Maple. We're open Monday through Friday from 8 a.m. to 4:30 p.m.
Very good. Thank you very much. And Dr. Underwood, before we let you go, I wanted to just touch base with you again about, I think we mentioned this last week or so, about the crisis standards of care and the important distinction that no patients are being turned away from the hospital. I always like you to kind of revisit that if you don't mind, and just explain what that means. Even though the hospital is in this crisis standards of care, you are still caring for COVID and non-COVID patients who arrive at the hospital seeking care, correct?
Oh, that's absolutely correct. Our emergency department is always open. We're still doing surgery for those that have medically necessary procedures that need to be done. So we are always open, for heart attacks and all of the other emergency care that we would normally be providing. So that is always ongoing. And speaking of which, there's a helicopter landing outside my window right now to show that we're still bringing patients in when they need care.
Thank you very much. And I did want to remind all of our audiences again that all the numbers that we gave at the beginning of the program about the numbers of cases and the positivity rates and things along that, I mean, those equal human beings. Sometimes we forget that, I think. And your folks, yeah. Dr. Underwood and Mr. Carraro, see that day in and day out at the hospital. And you were telling us about some of these numbers that you are seeing. And I just don't think we can lose track of that and lose sight of that these numbers represent human lives and human beings. And then they're connected to families and folks that care about them. And we need to keep that in our thoughts and prayers as well.
That is absolutely true, Scott. And thanks for pointing that out. It does. It impacts families, it impacts the people that have to care for them, and it's impacted our organization as well. We've had some of our own caregivers that have had to be admitted, and some have not done well. And so, yes, those are all very, very personal, deep impacts for the families and for the people that are around them. I still want to point out also, if I may, Scott, that of the patients, if we look at the month of October, just the month of October, that 81% of our patients are unvaccinated, compared to only 27% out in the public here in San Juan County are unvaccinated. So 27% of the patients out there, or 27% of our population, is making up 81% of our COVID patients. In the month of October, we had 17 patients die in our hospital from COVID. Only one of them was vaccinated. All the rest had not received a vaccine. So I cannot reiterate enough, please get the vaccine. And yes, it is a personal decision, but it is a personal decision that affects other people, because there are people who are unvaccinated here that are kind of putting us in crisis standards of care, and that's affecting other people from being able to get into those beds, like the 5 that I talked about that are now in the emergency department waiting to get into a bed because they're occupied. So please get vaccinated. It's the best option for you, and it's the best option for our public.
Very good reminder. And Dr. Bob Underwood and Eddie Carraro, thank you so much for joining us this morning. It's always a pleasure to speak to our hospital representatives, and you guys hang in there, and we support you, and thank you.
Thank you.